I don't show again, everywhere don't burst like. Hello upcoming anatomists and my guys we just wan revise. Today we dey do our video on top scapula. Scapula na bone wey dey the posterior aspect of the body. It is a triangular bone and flat bone. Flat bone meaning say e no be long bone wey get upper end, lower end and shaft, rather na flat bone wey be say the parts kind of dey irregular. So make we take a look at scapula. I know say some of una don already dey look the bone, but the thing no resemble say e get head or tail or anything. Everything just dey confusing and you just dey about to throw am away. Na the outline wey we wan use study the scapula be this on top your screen. Keep in mind that in this video, na the left scapula na im we go dey use do our examples. For anywhere wey we no use both, na the left scapula na im we go use. Now, make we take a look at the scapula. Make we introduce am. So, the scapula on both sides is triangular and is a flat bone. It is composed of a body and three processes. We get three processes of the scapula. Now, make we take a look at the body of the scapula. The body of the scapula is triangular and e get two surfaces. We get the back surface and the front surface. Back surface is the dorsal surface, which is the surface wey you dey see right now. This surface is divided into up and down portion by this thing wey demarcate am into two. A smaller upper surface and a larger lower surface. So this thing wey divide am into two, it is called the spinous process. It is called the what? The spinous process of the scapula. It is like a shelf wey just dey separate am into upper and lower portion. So we get supraspinous and we get infraspinous. Supraspinous above, infraspinous below. These are the portions of the dorsal surface. Next, we come get the costal surface. Now this surface dey related to the ribs. This surface is related to the ribs. The costal surface is related against the second, third, fourth, fifth, sixth, seventh ribs. You dey see them. This is the second, third, fourth, fifth, sixth, seventh ribs. So it is related against second to seventh rib. So just like every other triangle, there are three borders and there are three angles. So these three borders now, you dey see the one wey dey up here. This is the superior border. The one by this medial side, the one by the medial side is the medial border. You see it is medial because it is towards the center. Then we have the one that is by the lateral side, which is the lateral border. After this description now, me I no wan hear anything like medial, lateral, I no sabi wetin e be because if I catch you. Now, regarding the medial border, they also call the medial border vertebral border. Now, why is it called vertebral border? Because as you dey see, they kind of parallel to the vertebra. This vertebra, these things wey dey for back here, wey some of you like dey call spinal cord before, they kind of parallel to am. E dey about 5 centimeters away. So this medial border, they also call am vertebral border. Then we also get the lateral border. The lateral border is this border wey dey here. And this lateral border is pointing towards the axilla. E dey end himself for axilla. So sometimes they dey call am axillary border. Axilla na armpit. I don already talk am for my earlier videos. Now regarding the angles, we get three angles as we take talk before. We get superior angle, we get inferior angle and we get lateral angle. Superior angle and inferior angle, they no get too much things wey we fit talk about them because just like normal angles, they just dey bent and they dey sharp. So that's superior angle, that's inferior angle over there. In order to take a look at the lateral angle, it is best to look at it from this costal surface. So let's look at it from the costal surface. The lateral angle is modified so much that it is even in this region that we have the head of the scapula. The head of the scapula is this lateral angle that is fat. So you see this is the head. Then we also have the neck. That part will go inside before we have the lateral angle. That is the neck of the scapula. Now this neck of the scapula and the head of the scapula are the two other parts of the scapula apart from the body of the scapula, according to some authorities. Now, wetin happen be say this lateral angle dey modify himself at this point to form the glenoid cavity. The glenoid cavity na wetin the scapula dey use take attach himself to humerus, that's the bone of the arm, to form the shoulder joint. So this diagram just dey to show you the shoulder joint and how we take look. This is the picture of the shoulder joint consisting of the scapula and the humerus bone, and this joint you can see it from all around. This is how the bones articulate with themselves through the glenoid cavity of the scapula. So now the main gist be say the lateral angle of the scapula e dey fat in order to become glenoid cavity, of course. Now, the next thing na to move go the processes of the scapula. The process of the scapula too na just three. We get the spinous process, we get the acromion process, and we get the coracoid process. Now, for the spinous process. The spinous process e just dey like chef. I don already describe am wey dey knack for the back of scapula wey dey divide am into supraspinous and infraspinous portion. So if you look dis spinous process now, the spinous process e get dis part wey dey fat small for the center. Dat part na im dey dey call the crest of the spine of scapula. Crest, you see sey e just fat small, so e just dey like crest on top dat place. Dis is what dey call the crest of the spine of scapula, because dis is the spine of scapula and dis is the crest of the spine. So now we have the acromion process. Acromion process na the process wey dey ex ten d go up from the spinous process. E dey fatter than the spinous process wey we don look now. Dis is the acromion process. Now when you look to the front, we have the coracoid process. Coracoid process just dey like finger wey dey bend, like short finger wey dey bend. Imagine sey you carry your thumb and you bend am, na im be the coracoid process of the scapula. Dem dey call am crow's beak for some book. So you know crow na, you sabi the way the beak take bend. So na so dey take describe coracoid process. Some of una go dey wonder how we take put all dis stuff for our head. All na grace bro. No worry, just give am time small, everything go enter. Now make we take a look at how we fit position any scapula in anatomical position. First of all, you see dis spinous process wey we don talk about, wey dey back, wey dey divide am into supraspinous and infraspinous portion. Take am make e face back. Once e face back, you don get first step. Now second step, you see dis coracoid process wey dey here, dis coracoid process wey dey here, make sure sey e dey face front. Make sure sey e dey face where? E dey face front. Once dis coracoid process dey face front, the way dis one take dey face front now, you don do step 2. Den for step 3, make sure sey dis glenoid cavity, dis one here, make sure sey e dey face the side. Once e don dey face the side, shikena you don do step 3. Na so the clavicle take dey anatomical position. By the time you do dis on top the body, you go dey see sey the scapula go resemble something like dis. So dis is going to be the anatomical position of scapula. By the time you do dis one now for oral exam, all power belong to you. Now make we take a look at the features and attachments of the scapula. Now the scapula get features and attachments wey dey considerable from all im surfaces and on im processes. For now, we go look at the body, and on top the body we go discover sey we get costal surface and we get dorsal surface. So let us begin from the costal surface. Costal surface wey you see so, e get a direction wey dey like medial and forward. So the thing no be sey e just straight dey face front completely, e dey directed medially, meaning sey e dey face inside small and e come dey face front too. So now let us look at dis costal surface attachment. We get like 2 major muscles wey dey attach here. We get the one wey dey dey call subscapularis muscle. Subscapularis muscle, because it is attached here, the costal surface dey dey also call am subscapular fossa. Then we also get the other muscle, which is serratus anterior. Serratus anterior na insertion, not origin. Subscapularis muscle takes origin from most of this surface, that is in the subscapular fossa. Now for this dorsal surface get the superior part and inferior part, just like we talk, wey dey divided in the center by this spinous process. So the superior part na im we dey call supraspinous fossa, because e dey above the spine. Now we come get the inferior part wey dey dey call infraspinous fossa. So these two na the main regions of the posterior region. Now e get other features, other demarcations. For example, between this acromion process and the spine, you see the spine continue to give acromion process, abi? So between this spinous process, the acromion process, and the glenoid cavity, that's the glenoid cavity at the lateral angle, we get a small notch. Notch meaning say penetration, small penetration wey dey this side. They dey call am spinoglenoid notch. See am from the side, see am from up, see am from down. So that is the spinoglenoid notch. Na through this spinoglenoid notch na im the supraspinous fossa and infraspinous fossa take dey communicate, and e get one nerve wey dey pass through am. The name na suprascapular nerve. Now make we take a look at the muscles wey dey attached on this dorsal surface of the scapula. So if we look these muscles one by one, we get the supraspinatus wey dey for supraspinous fossa. Then we get infraspinatus wey dey for infraspinous fossa, that's below the spinous process. We come get these guys wey dey the lateral border. First of all, we have teres minor wey dey up, e dey carry about 2/3 of it. Then we come get teres major wey dey down below am. Then lastly, we come get latissimus dorsi at the inferior angle of the scapula, still on this dorsal surface. Now make we take a look at the superior border. If you look the superior border, e dey between the superior angle and the lateral angle. Now what e get like two major features for this superior border wey we dey look now. This superior border, first of all, e get only one muscle attachment. That muscle attachment na im be the inferior belly of omohyoid muscle. E dey around this location wey I dey tag right now. Then we also get the second feature, which is this notch. You see this notch wey dey here wey I dey touch right now. This notch is the notch that is known as the suprascapular notch. It give passage to the suprascapular nerve before the suprascapular nerve go come go turn, come go follow the spinoglenoid notch. So that is how the suprascapular nerve descends along the superior border before getting to the dorsal surface. E get one ligament wey dey cover the suprascapular notch wey dey convert am into a foramen. That name of the ligament na suprascapular ligament.
Now see the suprascapular ligament for here, e dey here. Then you come see the artery and the nerve dey pass above and below am respectively. You see say the artery dey above am and we see say the nerve go below the suprascapular ligament. So this is the suprascapular nerve, this is the suprascapular artery. Now make we look the medial border. So the medial border now dey give attachment to certain muscles, like first of all we have this levator scapulae. Levator scapulae from up down to the root of spine. So levator scapulae will give attachment to that side. Then we come get the rhomboidus major and rhomboidus minor. Rhomboidus minor go dey up for opposite the root of spine. The rhomboidus minor go insert himself, that is this part where the spine take dey comot, rhomboidus minor dey there. Then rhomboidus major go come carry the rest down until e reach inferior angle.
I know say the stuff plenty and you dey short of words, but na my time to choke you be this and I go choke you. Now make we take a look at the lateral border. Lateral border get a small tubercle close to the place where we get glenoid cavity. That's at the lateral angle. So this lateral border now, at this position where the tubercle dey, this lateral border is called the infraglenoid tubercle. Infraglenoid meaning say e dey below the glenoid cavity, then is a tubercle meaning say na small swelling. This small swelling na im dey use attach to triceps. Triceps dey attach for this position. So that is the lateral border. Lateral border thick well well, but na just only one attachment. So na just big for nothing e be. Now make we look the angles. The angles wey we get superior angle, we get inferior angle. These two gist no too dey o, gist no plenty. Now let's look the lateral angle. For the lateral angle now, we see this side. We don talk before say e dey modified to give glenoid cavity, abi? So you see this glenoid cavity now, at that place you see this thing wey dey attached to am, this thing wey I dey tag right now, this is the glenoid labrum. This is the glenoid labrum, which is a structure wey dey deepen that glenoid cavity so e fit hold the head of the humerus properly, make dem fit articulate properly. So that is essentially what the glenoid labrum is. So it's giving attachment to the glenoid labrum there. Also, e dey also give attachment to other things like the capsule of the shoulder joint, and also just above the glenoid labrum, e dey give attachment to the head of triceps at something that's called the supraglenoid tubercle. The supraglenoid tubercle wey dey here. Now guys, make we gist more about these processes of the scapula. The process of the scapula, as we don gist before, we get like the spinous process, we get this acromion process, then we come get this coracoid process for front. Now make we look at these things one by one. No worry about all those things wey you see for the image, they are all just ligaments and we go talk about them soon enough. So this spinous process, first of all, we don already describe say they split the clavicle into two portions, the superior and inferior portion, which are supraspinous and infraspinous fossa respectively. We can already see say now, based on say this thing dey divide am into superior and inferior portion, and we call am say e resemble like shelf before. This thing has a superior portion that is forming the inferior boundary for this supraspinous fossa, and it also has an inferior portion that is forming a superior boundary for infraspinous fossa. So it has the superior surface and inferior surface that are doing those jobs. Then this thing can extend laterally, you can stop for around where we get this spinoglenoid notch. We don already see am before, this spinoglenoid notch. So it is stopping at the spinoglenoid notch. Spinoglenoid notch is forming the lateral boundary. The two major attachments wey we get on top dis thing na the trapezius muscle and the deltoid muscle. So trapezius muscle go just come and insert himself around here along dis superior margin here, while the deltoid go come insert himself around dis inferior part and dis posterior part. So dat is basically how the two of dem will insert themselves on dis surface. Now moving on, we are going to go straight into the acromion process. Now make we look at the acromion process. The acromion process dey ex ten d from dis spinous process, and look at it, e dey form like kind of small bend around dis position to like give a 90-degree kind of angle with dis spinous process. Now dis acromion process get a few ligaments wey e dey attached to, of course. So dis first one wey I dey tag right now, dis is called the acromioclavicular ligament, and it connects the clavicle with the acromion. It also has dis ligament here that is called the coracoacromial ligament. The coracoacromial ligament connects the acromion process and coracoid process of the scapula together, and it's one of the strongest ligaments in the whole body. So those are two ligaments of this acromion process. This acromion process also give attachment to some other things like deltoid and trapezius muscle. So you see this deltoid muscle, e dey outside for this outer border here, this outer lateral border, deltoid go insert there, and along this medial inner border, the trapezius will insert there. So that's the way these two muscles attach themselves along the acromion process. Then last but not the least, we have this coracoid process. Coracoid process, we don already mention earlier say e dey form coracoacromial ligaments together with the acromion process wey we don treat earlier. Then we also have some other bunch of ligaments that is attaching to this thing. For example, now we have the coracohumeral ligament that is linking this coracoid process and the humerus. We also have the coracoclavicular ligament that is connecting this coracoid process and the clavicle. This one that I'm tagging right now is the conoid portion of it. We also have the trapezoid portion of it. If you remember from my earlier video of clavicle, we have already mentioned that we have the coracoclavicular ligament that and its conoid and trapezoid parts attaching in the clavicle along the inferior surface in the lateral one third. So that is the same ligament that is coming here to attach on the coracoid process of the scapula. Also, we have muscles that are inserting here. For example, we have the pectoralis minor muscle. Apart from the pectoralis minor muscle that is inserting around here, we also have two other muscles which are coracobrachialis and biceps brachii, which is the short head of biceps brachii. These two are coming to come and insert themselves at the tip of this coracoid process. By now already, you for don dey feel like Stufus compactus, like say everything for your head don compact, everything don condense, but make we just add one small stuff before you go. You see this acromion process, e get another fun fact about am. You see this superior surface now, this part wey I dey tag right now, e dey rough, and this part na im dey palpate for tip of shoulder. That part na im you dey feel if you touch your shoulder, the image dey your screen. You see under am, this place, e dey smooth for this place, this under surface, the under surface dey smooth. That part at the under surface, that part na im dey related to one bursa like that. We go know about bursa later when we really get into the anatomy properly. But for now, just keep that Stufus compactus for your head. I sure say by now everything don dey metete for your side. Thank you for watching. If the video makes sense and you learn anything, abeg try comment for the comment section. Remember to like the video and subscribe before you leave the channel. Have a nice day.